Hi, everybody. This has been a great day and a half. I just want to start by thanking the Health Literacy Roundtable for joining the National Cancer Policy Forum and also the staff of both groups in helping put this together. And of course, thank our great planning committee and speakers. Please give them all another round of applause. Many still in the room. I especially want to just call out one member of the planning committee. So I am a behavioral scientist and I do work in cancer, but I'm really not an expert in health literacy. And so when we started doing this, I said, we really have to get Kathy Mead because she has devoted her whole career to the intersection between cancer and health literacy. So Kathy, I really appreciate your efforts and your contributions to this. Thanks. So I am really challenged here to summarize all the great thoughts, and I will not do it justice, but I was telling my husband that I have to do this, and I was like, I don't know how I'm going to do this. He says, everybody's tired, make your 3 points and sit down. So I'll sort of do that, hopefully concisely. So the first thing that sort of occurs to me, I was a little bothered when we were doing the agenda by the idea that we were addressing both the issues of health literacy in sort of the patient context and the issue of health literacy in more of the public health primary prevention context in the same workshop. And, it's like, this is a lot. Is this really similar? But I really felt like there were a lot of common themes across those two areas, and they're kind of two sides of the same coin. For one thing, the public health prevention is the, preparation to be a patient, hopefully preparation to not be a patient or to avoid being a patient for as long as possible, but almost all of us do eventually become patients or help take care of somebody who's a patient. So that sort of basic, the public health education that happens is really important. And I think also really a strong theme through a lot of the presentations was the issue of trust and trustworthiness, and that really cuts across both these areas and across the whole cancer continuum, and how we sort of engage the community and engage patients and families and communities to enhance that trustworthiness, including that community voice. The second theme that I really pulled out of this was the idea of the patient team. And I loved that Heidi Donovan made this point about patient teams, that it's not just the patient, it's the caregivers as well. And that we really need to, in the context of health literacy, we really need to think more about them. And I think it really resonated for me with what Marjorie was also saying on the first day of, we have this very individualistic, autonomy valuing culture, and most of our population is not coming from a culture like that. And certainly once you become a patient, I think it's really hard to stay in that mode where you're like one person alone making your decisions. You rely on your networks. And so thinking more about how we address the needs of the patient team, not just the patient. And the third sort of takeaway for me is thinking about testing interventions, and really, we have looked at a lot of the literature and the planning of this workshop. There's a lot of descriptive literature on how this is a problem, relatively little research testing actual interventions, particularly when we think about multi-level interventions. One thing we didn't talk, we touched on, and maybe it's like we're all really tired of talking about the EMR, but EMR portals and what their potentials and limitations are, and how we could improve them for patient communication and issues of interoperability, I think are really important. And thinking about also interventions for teams, the patient team, the caregiver team, as well as the community. And excited to kind of hear Sylvia Cho talk about misinformation and helping us think about how we develop better interventions, communication interventions, to sort of counteract some of the misinformation that's being propagated. So that is, and the last thing I wanted to say is that I think NCI has a nice opportunity now that they have really gotten all the cancer centers on board with doing community outreach and education, is to maybe create some sort of supplement or encouragement for those programs to leverage those COE activities to help bring the community voice into communications that they do with their patients and in their public education efforts. So just think about that, Sylvia. Take that back with you. All right, thanks.
Thank you, and I also want to thank the National Cancer Policy Forum. It's a natural synergy for the Roundtable on Health Literacy to be working with you, and very happy to have done so, and to continue that going forward. And also the staff for the National Cancer Policy Forum and the Health Literacy Roundtable. Thank you, guys. You did a really good job at summarizing the points, so in deference to most deaf, I'm going to try to sum it together in another fashion. Cannot be done alone, caregivers in the home. We'll take a whole team. EMR interoperability will not be a dream. Okay? Misinformation is a blight in our nation. Care that is empathic and activating, cultural humility will be unifying, health literacy across the continuum of cancer care, empower if you dare. Thank you very much.